Hello, and thanks for tuning in. My name is Jeremy Jones, and I'm the Residency Program Director for Ophthalmology at the Emory University School of Medicine. We all sincerely appreciate your interest in our residency training program and hope that this presentation can provide some insight to our program. Really, what we hope is that this presentation, along with your interview day and spending time with our residents, will help you determine if Emory is the right fit for you. As I tell all of our medical students and all of my mentees, the ophthalmology interview process is just as much about you finding the right program as it is about the program finding the right candidate. We think we provide a very special training environment and hope that this comes through in this presentation and your interviews this weekend. First, I'd like to introduce who we are. My name is Jeremy Jones, and I graduated from Emory's residency program in 2012. I loved working with the faculty here and the patients at Emory, at Grady, and at the VA, and was overjoyed when I was asked to stay on as faculty. I began as residency program director in 2016. Pictured here beside me is Blaine Cribbs, our associate residency program director, also an alumnus of our residency program. Both of us are committed to recruiting and training a diverse group of residents that are well poised to be leaders in ophthalmology and patient care. We are delighted to have such a talented group of applicants this year and look forward to meeting you over the next few weeks at your interviews. You've already heard from Dr. Beck. It's been a true joy working with Dr. Beck, knowing that he shares the vision of the department as a beacon for resident education just as much as I do. As he stated, he's also a graduate of our residency training program and truly knows the value that the residents offer the department and the faculty can offer to the residents. He wholeheartedly supports resident education and is dedicated to making Emory a destination for ophthalmology training. Of course, we all know that the real person that pulls all of the strings, or on some days pushes all our buttons, is the fabulous Miss Trotter. She is our residency program coordinator extraordinaire, who is sadly retiring this year, but not before she gets to coordinate her inaugural virtual interview sessions. We appreciate all the hard work she's put into making your interview day possible and all the information and knowledge and love she's passed on to our residents over the years. Today I want to give a brief overview of our program, discussing our facilities, clinical experience, our curriculum, the call schedule, opportunities for research, our faculty, our alumni, and really how great it is to live and work in Atlanta. Our program is a moderately sized ophthalmology training program consisting of 6 residents per year. We are a highly clinical program, meaning that you'll spend most of your time in clinic and use those patient care experiences to guide your learning. With a high clinical volume, our surgical volumes are also high, ensuring that all of our residents graduate as competent and capable ophthalmologists. Being a resident in a busy clinical program means that you're going to have to rely on your co-residents, and that's our charge this weekend, is to find 6 applicants that will blend in seamlessly with their 12 senior residents. We really put focus on being a good team player, showing initiative, and being part of a cohesive group that can work well together. In addition to that, we've got 67 excellent faculty, 43 of which are clinical, 5 research faculty, and 16 optometrists. And through this variety of outpatient settings, you can see there's a massive amount of outpatient visits per year. A large part of what makes our program special, if not unique, are the clinical training sites. Training at such a diversity of clinical sites is what drew me to Emory, and a very large part of what I think makes our residency program excellent. Residents will work at a busy county safety net hospital at Grady, where patients view the residents as their primary eye care providers. Additionally, residents rotate through a very busy VA medical center and have access to all of the resources the VA has to offer. In addition to Eggleston's Children's Hospital and the Emory satellite clinics, residents spend a large portion of their time at the Emory Clinic, side by side with preeminent experts in all subspecialties. Hearing that there are so many different sites, one might wonder how far away all our sites are, how much time they'll spend in the car traveling between sites. Well, the good news is all of our sites are within a 5 to 10 mile radius, which even with Atlanta traffic means it's usually no more than a 30-minute drive, even during rush hour. As we discuss our clinical sites, first up is Grady Memorial Hospital, led by our chief, Yousuf Khalifa. Dr. Khalifa joined us 5 years ago and brought the right mix of enthusiasm, instinct, and intelligence that was necessary to move Grady's eye clinic into the 21st century. In addition to securing our wet lab space and equipment, he's worked tirelessly to secure funding to renovate the eye clinic, to start a teleretinal program, and to greatly increase surgical volume at Grady. Excitingly, the work's not done. Across the street from Grady, if you've spent any time in Atlanta recently, you'll see the beams going up and the cranes building our new ambulatory surgery center, in which we'll have our own floor and 2 dedicated eye operating rooms adjacent to our clinic. At Grady, we really expect that the residents are acting as the patient's physician. Faculty are always present, but we hope that the residents feel comfortable enough to make their own decision before approaching a faculty member. We feel that this model of supervised autonomy growth is maximized. In addition to all of the newest equipment, Grady also has full-time optometrists that helps feed into our clinical and surgical practice. In our clinic, there are about 20,000 visits per year. Subsequent to this, there is also a very high surgical volume, which you can see here, about 1,500 cases per year, about 1,000 of which are cataracts. Importantly, you should know that these surgical numbers are almost in their entirety performed by residents. We expect you to treat this clinic like your own and build the bonds needed to care for the patients at Grady and beyond. Next, we have the Atlanta VA Medical Center, led by our chief, Steve Erkin. Dr. Erkin is a graduate of our residency program and is likewise dedicated to professional, clinical, and surgical education of all residents at Emory. Under his leadership, the VA faculty has grown tremendously to include all specialties and to be one of the busiest VA eye clinics in the Southeast. Like Grady, the resident clinic at the VA runs in such a way that residents take responsibility for all their patients, but are supervised by experts in cornea, glaucoma, medical and surgical retina, uveitis, and oculoplastics. Also, like Grady, the VA is a very busy clinical practice. Don't worry, 5 residents are not responsible for seeing 45,000 patients, as faculty have their own clinics at the VA as well. But this high volume does lead to a high volume of surgery for all the residents at the VA. These numbers on this slide are from the last few years, and the numbers obviously took a hit last year because of the pandemic, but in a typical year about 1,000 cataracts are performed in addition to a high volume of clinic, laser, and minor procedures performed in the resident clinic. At Emory, the learning environment is more typical of a traditional academic program. Here the residents work side by side with world experts in their fields. They work with faculty and fellows, caring for a range of pathology that one would see at a tertiary care eye clinic. Given the large number of faculty with varied clinical, service, and academic interests, residents are able to form the relationships that will help springboard them to the next stage of their careers. Additionally, residents also spend time at Children's Healthcare of Atlanta at Eggleston Hospital, which is adjacent to the Emory Clinic here on campus, and as they work with our pediatric ophthalmologist, and at EUH Midtown and St. Joe's, where they get some experience in the evaluation, management, and surgical techniques necessary to be a busy refractive surgeon from some of the most sought-after surgical lecturers in the country. Like many other programs, ours follows a structure of graduated clinical and surgical responsibility. As a first-year resident, a majority of your time will be spent at Grady in the VA learning how to care for patients in your resident clinic. Also, however, you'll rotate through Emory and work with all specialties throughout the year. The surgical experience is mostly limited to minor procedures, lasers, and some extraocular surgery. Beginning in the second year, however, more begins to be expected of you as a leader. You'll help guide the first year's medical students, interns, as they look to build their base at Grady and at the VA, and will further refine your knowledge with subspecialists at Emory. Traditionally, during this year, you also begin your experience as a primary cataract surgeon, completing the second year with 15 to 20 primary cataract surgeries. And finally, as you come to the third year, your surgical training begins in earnest. For 8 of the 12 months, you'll be on a primary surgical rotation at either Grady or the VA, in which you operate every other day. During your 4-month Grady block, you'll typically perform 200 to 300 primary procedures with 150 to 200 cataract surgeries. Remember, these are your surgeries. Faculty are present and are supervising and teaching you, but generally only step in if absolutely needed. Similarly, at the VA, you're responsible for the surgical care of this high volume of patients, which again gives you a robust surgical training. As I stated earlier, at Emory we really want you to take ownership of your patients. While faculty are present to staff clinic, we expect that you will treat each encounter as if you had to make the decision without us. In doing so and discussing this through, your learning's reinforced. Again, we want you to act in a way that you feel like you're autonomous, but you know that you have supervision. Importantly, all surgeries are staffed by faculty or fellows, and early experiences in the operating room occur with skilled cataract surgery educators. As you can see here, our surgical volumes in a typical year are very high, placing us in the upper quartile for almost all procedures. Admittedly, last year's numbers have been omitted in light of the pandemic, but even last year, the minimum number of cataracts performed was 134, and the average was 178. You'll most definitely come out of Emory well prepared from a surgical standpoint, regardless of what you want to do after residency. Like many other programs, our didactic curriculum consists of resident and faculty-given grand rounds, as well as scheduled lectures. We have regular time on Friday mornings for these lectures. We do have some other early morning lectures, but we do not have any weekend or night lecture series. Based on feedback from our residents, we've also initiated peer-to-peer lectures throughout the year. One of the things I'm most proud of, however, is our cataract surgical curriculum. We began this in 2015, and I think this plays a large role in getting our second and third year residents prepared for the operating room. We have a yearly 5-week course in the spring consisting of lectures based on all steps of cataract surgery. Residents then practice these steps in the wet lab and record these sessions for review by a well-seasoned cataract surgery educator. In doing so, our residents have a jump start on their preparation for the OR and are able to hit the third year running. So that all sounded really good, and then 2020 happened. But out of this challenge, I think an opportunity has presented itself. With the advent of improvement in our streaming technologies, we're now able to easily record grand rounds, all of our lectures, in addition to our undergrad basic science courses, biology of the eye, as well as our global ophthalmology lectures. As we continue to build this repository of lectures, it offers great opportunities for innovation in the delivery of knowledge and providing residents with learning that occurs in real time when they need it. Now, second to cataract surgery numbers, I know this is the topic that you all want to hear about. All of our call is home call, and you make the schedule. As long as you guys are all happy with the schedule, the 6 of you will make it. This allows you to make that call schedule and work that schedule around your life. You know, as a first-year resident, call is split in the first half of the year. It's Q4 call for Grady and Q2 call for VA and Midtown. The second half of the year, when the call is combined, covering all 3 hospitals, we've developed a night float rotation in response to resident feedback over the last 2 years. This allows for less fatigue, improved flexibilities on days following a night that's not so busy. During the second year, you take Q6 call covering Emory University Hospital as well as the Children's Hospital. And importantly, as a third year, your call is all backup call. You're responsible for backup call on a Q6 basis, which means you only really need to go in if a junior resident needs help or if you need to operate. And as I said before, this is all call taken from home, and you guys make your own schedule. Following a change in ACGME requirements, we've transitioned to a joint PGY1 program. Our interns are all matched in Emory's transitional year program. Kimberly Manning, an expert in resident education, a writer who you may recognize as at Grady Doc, an all-around great role model and mentor, guides your experience as a PGY1. During this year, in addition to your diverse clinical training in medicine, you'll spend 3 months on ophthalmology, 2 at Grady and 1 at the VA. In doing so, you come well prepared to jump right in and learn ophthalmology as you begin your first year of residency. In addition to the busy surgical and clinical nature of our program, Emory obviously has a strong research tradition. Emory maintains a strong basic science and research presence, and our residents are required to get involved. Our residents consistently present at all of the national meetings, and importantly, doing so supported by the department. We want you to get involved. We understand that this is a very busy clinical training environment, but there are opportunities in whatever subspecialty you're interested in to start making an impact even as a resident. In addition to all these things, we're very lucky to have a strong and growing global ophthalmology presence. Jacqueline O'Banion, who's our Director of Global Ophthalmology at Emory, or Go Emory, has worked to develop a global ophthalmology fellowship. Our department has strong ties with Orbis, the Himalayan Cataract Project, as well as other NGOs. Additionally, thanks to Emory's Global Health Research Scholars Program, one resident a year has been selected to participate as a Global Health Research Scholar, taking part in a year-long curriculum that culminates with a month-long rotation and research experience in Ethiopia. Obviously, secondary to social events as well as the ongoing pandemic, this has been placed on hold. However, we hope to be back and get Emory back out in the world next year. One aspect of our residency program that we don't often highlight or talk about is diversity in ophthalmology. Obviously, ophthalmology has been a field that has a major diversity issue. Our department is no exception. While we're working on improving diversity in our faculty and trainees such that our providers are a representation of the patients we serve, we definitely have a long way to go. As a school, Emory's made commitments and are already making great strides from an undergraduate medical student and faculty recruitment and retention standpoint. In our department, we've similarly appointed Dr. Buse and Dr. Patel to positions aimed at making sure we, as a department, continue moving forward. Both of them have been very involved on a national level as board members of Women in Ophthalmology or as the chair of Committee of Diversity, Equity, and Inclusion for NANOS for Dr. Buse. And additionally, partnering with our community partners, such as Nanita Brown, current president of the National Medical Association Ophthalmology Section, as well as Morehouse College and School of Medicine, starting to lead what we hope can be a better conversation about how we get Black, Indigenous, Latinx, and other underrepresented minorities interested in ophthalmology and coming here to Emory. Lastly, before we talk about our alumni, I'd like to highlight one other thing that Emory has to offer, which are Emory's GME Tracts. These include tracks in ethics, global health, healthcare management, health equity, advocacy and policy, medical education, and quality improvement and patient safety. These are run through the School of Medicine, but as a department, we're happy to support residents if they have an interest. So definitely check out the Emory's GME website if this is something that might appeal to you. So where do our residents end up? Being a large academic institution, not surprisingly, a majority of residents pursue fellowship. However, a large proportion start immediately in private practice because they graduate from Emory well-trained and able to join or start a practice on their own without any additional training. So where do they go after training, after their fellowships or after their first few years in private practice? As you can see here, about 2/3 of our residents end up in private practice long-term. But importantly, we feel that our residency training program also gives you your first step into academics. And around 25% of our residents have settled into academic positions after they finish their training, showing that really, this is the first step of your career and you can take it wherever you want to go. So I do want to spend a few minutes talking about what it's like living in Atlanta, and hopefully you'll get more of this from the residents while they talk to you during the Q&A sessions or during the informal gathering next week. But Atlanta is a big city of 5.6 million people. It feels like a big city when you're downtown, but just a few minutes outside of the city, you feel like you're in a smaller town, a smaller neighborhood, in any of the surrounding neighborhoods around Atlanta. Obviously, it's a cultural and business center for the South and the Southeast with a large number of Fortune 500 companies headquartered here. We do have, the world's busiest airport in Atlanta's Hartsfield-Jackson International Airport, which is an excellent thing if you don't live in Atlanta or if you like to travel, because you can get out really very, very easily. And if you like to eat, Atlanta is consistently on the list of 10 of the best top 10 in food cities in the United States. Say you like sports. What do we have going on? being a large city, we do, in a large market, we do have all of the major sports team. We have the Atlanta Braves for baseball, the Falcons for football, the Hawks for NBA, Georgia Tech, University of Georgia, and really our only champion recently, the MLS Atlanta United. If you're more a fan of traditional cultural offerings, we also have the Atlanta Symphony Orchestra, the Fox Theater, High Museum of Art, a number of large and small concert venues obviously scattered throughout the city. Truly, Atlanta is a great place to live. It's been a great place for me to raise a family, and I really can't imagine living anywhere else. So that's all I have for you today. I really appreciate you sitting through this with us as we're pictured here with last year's graduating class with our, obviously with our mask, of course. But we hope to one day see you here. I hope that this has made, given you a little taste of what Emory is about, and hopefully we will see 6 of you here in the next few years. So thank you very much. Enjoy your interview, and if you have any questions, feel free to reach out and call us. Thank you.